Move Well, Live Well. We get a number of people that come in here with issues regarding pelvic pain and SI joint pain is what they're presenting with. And most of these folks are women. And with women, they're going through pregnancy or they've gone through childbirth. And what's going on with them is that their pelvic floor muscles have gotten weak and it's causing pelvic pain and SI joint pain. Now, I brought out Netter here. I don't know if you can see this here, but I brought out Netter, and can you see that? Yeah, is that a good, pretty close? So this is the inlet view, so I'm looking top down. And if you look at these muscles right here, this is the pelvic floor. You see that? And just think about these muscles. These muscles help support the bladder, the uterus, the small intestine, and the rectum as well. And if you look at these muscles, you can kind of see that right there, correct? You can see them? Now, if they contract, you can kind of see how it holds the pelvis in one unit here. You see that? If this all contracted, you see all the different fibers and different ways they're going right here? If these all contract, they tighten up the pelvis, which is this right here, this ring, if you will. This is the sacrum. You can even see the SI joints here. Can you see the SI joints? Can you see the SI joints right here? Right there? So these are the SI joints. You can see if this contracts, it pulls it all tighter. And then that SI joint pain goes away. So, SI joint pain with women, the ligaments become lax during pregnancy because of that hormone relaxant allow for baby to pass through the birth canal. So SI joint pain, the ligaments become lax, but because of the weak pelvic floor muscles, you have that pain. Also, incontinence. They start getting urinary incontinence and even fecal incontinence from like a sneeze. They can be sneezing, laughing, sometimes just walking or kind of just jumping a little bit or running. They'll get a little bit of urinary incontinence. Some urine will kind of come out a little bit, or even fecal incontinence too. So, and a big one too that we sometimes see is sexual dysfunction, pain with sex, and also problems with having an orgasm, and that's not good. So anyway, these are just some of the things that we see when some of these women come in and they're having pelvic pain and SI joint pain, is that pelvic floor muscles have become weak. So how do you fix that? How do you fix pelvic floor dysfunction? Well, what do? It's an often neglected but easy to do pretty much anywhere, and it's free. They're called Kegels or Kegels. If you know how to pronounce it better than I do, let me know. Drop it off in the comment section below. But they're Kegels, also known as pelvic floor exercises. Pelvic floor exercises. So, Kegels. So, how do you do Kegels? Well, how do you activate these muscles? Well, what you do is the muscles that, if you're going to the restroom or you have an urge to go to the restroom, there's a muscle, the pelvic floor muscles, it's the muscle that helps to stop the flow of urine. So if you're going to the bathroom and you want it to stop, it's the squeezing of those pelvic floor muscles that allow it to stop. So it's the squeezing of those muscles that allow you to go to the bathroom. So let's say you have to go number 1 or number 2 and you get that urge to go. In order to activate the Kegel exercises, the pelvic floor muscles, you have to contract those. See, I'm doing it right now. You don't even know. So what's great about the Kegel exercises is that you can do them anywhere. You can do them standing. You can do it lying down. What we usually recommend, folks, is do them once a day. We know you go to bed probably once a day, so start there. So before you go to bed, Kegel exercises. So we usually recommend working up to 5 sets of 10 to 15 reps, and you're holding them for 3 to 5 seconds each repetition. So it's hard to demonstrate like this, but here I go. So you start with 1 set and you go 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. Do that 10 to 15 repetitions. That's 1 set. And then you'll find sometimes with folks who have been battling this and struggling with these issues, is that sometimes 1 set is enough to fatigue that area. So just 1 set of 10 to 15 reps is enough to fatigue it. So work up to 5 sets of 10 to 15 reps each day. This is daily. And we usually tell folks do it right before you go to bed. And it's easy to do. And then you can even practice while you're driving, while you're at work. You can do a set there. You might even break up the sets where you do 1 in the morning, you wake up, you do a set. You do 1 in the afternoon, you do a set. You do 2 or 3 in the afternoon or in the evening. And there you go. You've had 5 sets throughout the day. So that's how you can break it up. And then you can even work up to holding it for 10 seconds at a time. So here I am. I'm going to hold it for 10 seconds. Ready, set, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then release. You can do these anywhere, anytime. It's one of the most neglected and underutilized exercises for SI joint pain, pelvic pain, women who are pregnant or have gone through childbirth. Their pelvic floor muscles have weakened and they're having all these issues. SI joint pain, incontinence, and even sexual dysfunction. So, easy to do, anywhere, free. So, if you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new to this channel, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well, live well. Also, I know you know folks who are battling pelvic pain, SI joint pain, incontinence, those types of things, sexual dysfunction. Share this with them. Sharing is caring. And these exercises have been around for a long time, and they're the most underutilized, most neglected exercises that we don't do. So share this with them. Also, give us a thumbs up, give us a likes, give us some likes, and it'll let us know that you care. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.